Hello, my name is Lori Blanton, and I am a certified diabetes care and education specialist. I'm also the diabetes program coordinator at Advent Health located in Tampa, Florida. Today, I'll be going over standard number 3 of 6 from the 2022 National Standards for Diabetes Self-Management Education and Support. I will begin by showing you some practical examples that you are welcome to use for reference when you're building your own comprehensive diabetes education service. And this will also help prepare you if in fact you do ever have an audit. So you're welcome to use any of this information, and we will proceed forward together. So standard number 3 primarily talks about the team members that are providing the DSMES service. And we'll go over each of these individually based on the review criteria of standard number 3. So at standard number 3, the first section, the review criteria A, speaks about the quality coordinator. And the quality coordinator needs to ensure that the DSMES services are person-centered and understand the process of identifying, analyzing, and communicating quality data. The quality coordinator may partner with other team members to support quality improvement. And although the quality coordinator does not require additional degrees or certifications in informatics, for example, developing an understanding of these skills, as well as marketing, healthcare administration, and business management, would be helpful as the healthcare environment continues to evolve. The quality coordinator role may vary depending on the setting of the DSMES services and may or may not be part of the instructional team. So oftentimes the American Diabetes Association Education Recognition Program, the ERP, they will get asked who could be a quality coordinator. And that answer is highly variable. When you're reading the language from standard 3 of the national standards that we just went over, you'll see that quality coordinators could come from many different pieces. It could be part of the instructional team. It could be a diabetes care and education specialist who is overseeing the implementation, the design, the plan of the education service. But it also could be an office manager. It could be a compliance specialist. All of the DSMES services across the country have different reporting structures, and they may report to an outpatient, marketing or business development director, or they could report to a wellness, or they could be part of a hospital system and various roles. So the answer to who could be a quality coordinator, these are just a few ideas, but this is definitely not all inclusive. The quality coordinator could be from many different backgrounds. And of course, you are welcome, if you have questions about this, to contact the Education Recognition Program team at ADA directly, and they would be happy to tell you if you have this person or you are the person who is the quality coordinator if you qualify and meet the standards. So they'd be happy to go over that with you if you have more questions. So diving into the next set of review criteria for standard number 3, this is one of the most talked about portions of standard number 3, talking about who the DSMES team can include. So it can be one or more healthcare professionals. And the credentials that are listed here, you will see registered nurse, you will see registered dietitian nutritionist, a pharmacist, board certified advanced diabetes management professional, a BCADM, or a certified diabetes care and education specialist. And I just like to, capitalize and bold that "or" for certified diabetes care and education specialist. So as many of you know, CDCESs can come from a very large background of healthcare related disciplines. And this list is not inclusive to registered nurses, dietitians, pharmacists, BCADM, or CDCESs. So let me show you a few examples of how this could work. DSME team members could be all of these different backgrounds. So the "or" is a very important word here. So Please remember that we are trying to support people with diabetes, and the people with diabetes definitely benefit from having a multidisciplinary team. But even if you are a single discipline team, meaning your staff is made up of only RNs, that is still acceptable if you meet some of the requirements that we're going to go over with the national standards. What can get very confusing about this standard is that for some services, in my experience with auditing some of those services, they believe that their team has to have an RN and has to have an RD. And that kind of reminds me of they're reading the first half of this sentence and not the whole thing for the national standards. It is a very long sentence with lots of ors, but it means that, an RN and RD could definitely be part of the team, but also a pharmacist could be the team instructional professional staff member, or a CDCES who is not an RN, who is not a pharmacist, who is not an RD. So here's another visual example here. And if we look at the top left, the first example, it's showing that the quality coordinator is a CHES and CDCES. And on that team, there is an exercise physiologist who is also a CDCES, and there is an MCHES CDCES. If you notice, none of them are RNs, none are pharmacists, none are RDNs, but they are all certified diabetes care and education specialists. So that team presented in the top left there, that would be in compliance with standard number 3, because they all actually have a CDCES certification. So that is in compliance. And then looking on the lower right-hand corner, I like to show this one as well, because you could have a quality coordinator who happens to be a pharmacist, and their team has a registered nurse and a registered dietitian on their team. If you notice, none of them are certified diabetes care and education specialists or BCADMs, but yet that example of that particular service would also be in compliance with the national standard. So this is just showing you that as long as the top left has a CDCES on their team, that is acceptable. And the bottom right example would be these are meeting the professional practice experiences who are not yet CDCESs. All right. And then, of course, with any standard, and especially if we have to be in preparation for any type of audit, your DSMES team members must all have current licenses and or registrations or certifications that are not expired. So this is kind of more of an obvious one, but it's a really important point. We want to make sure that the team members are qualified, they can provide diabetes education within each discipline or their respective discipline and scope of practice. Professional team members must have the valid discipline-specific licenses or registrations. This also plays a role if you have other disciplines that may not have a license. So for example, an exercise physiologist is not a state license like an RN would be or something like that, but it is another additional certification or professional practice experience. And then remember that exercise physiologist could become a CDCES. So we just want to make sure that if you are a professional team member and you have your CDCES, we want to always make sure that it is up to date and not expired. So that can be checked. So for example, if you were to be audited and you have a team with some certified diabetes care and education specialists, and you don't happen to have their certificate printed out, you can find the verification can be done directly from the cbdce.org website. You can verify that. And then if you do have a professional background that requires, state licenses or national registrations. So for dietitians, a CDR information with expiration is needed. If there is a nurse, then make sure that it has license status. You usually can check it at this website listed here. And just make sure that you include the expiration date, as some state databases for nursing doesn't always include the expiration date on the license. Most of them do, but please make sure you always have copies of these. So for your DSMES service, if you have a dedicated binder with standard number 3 flagged and tabbed, we want to make sure every license or discipline or registration is included, or that could also be a copy of someone who is holding a CDCES certificate that would be included as well. Right. And then for this particular piece, this is making sure, again, that the team members who are part of your service have up-to-date information and can show mastery of diabetes knowledge and training. So a way for team members to do this is to obtain the CDCES certification or the BCADM certification. So we want to make sure, again, those are up to date and current, documented accordingly with expiration dates. But this is a way for professional team members to demonstrate mastery of diabetes knowledge. And this is just an example. It happens to be my example of my CDCES certificate, and it has our number on it, it has our renewal date, and it has our certificate expiration date as well. Now, another way the professional team members who are not CDCESs and are not BCADMs, they can show professional diabetes knowledge and training mastery by obtaining 15 hours of continuing education by the list of approved providers decided upon by the Certification Board for Diabetes Care and Education, CBDCE. And these 15 hours must be accrued annually. So this is important to make sure that you have those annually. So for example, it's based on the DSMES service anniversary month. So this particular, on the top right, the red where it says anniversary date. So let's say your service anniversary date is every April, and you have a non-CDCES or BCADM team member. Maybe you just hired a brand new registered dietitian nutritionist who has not yet obtained all the hours to take the CDCES exam. That is definitely possible, but for them to present their mastery on diabetes education and knowledge, they would have to show 15 hours of continuing education hours. And this has to be done within the anniversary year, right? So if the anniversary date is April of 2023, and let's say you just had someone brand new on your team who is not yet has the CDCES certification or BCADM, they can obtain 15 continuing credit hours from April 2023 to April 2024. That would be their window to obtain those hours. And the little tip that's listed on the top left, this is talking about the CBDCE list of approved providers. You can find that on their website to make sure that the provider you were getting the CEs from has been approved. They also have another portion that's very helpful is maybe the person is working on obtaining a new degree related to their professional practice. So we have some that maybe they were registered dietitians and now they're working on getting their master's of public health degree. CBDCE will allow a certain amount of continuing education credits from accredited academic institutions in the US. Related to the professional practice. So if you have some questions about that, about, if it would be your academic degree would qualify as counting as continuing education credit hours, you also could ask cbdce.org, get in contact with them, and they could also give you confirmation of that information. All right. And then for team members that you may have that are the newly hired professional team members who do not yet have the 15 hours of continuing education, This part of the standard is the requirement. So if you hire someone, let's say you hire them in April because your service anniversary date is April, and you decide to hire them in May, and let's say they're a brand new team member, registered nurse, they're a pharmacist, and they do not have any recent hours of continuing education and diabetes specifically, with that approved list by CBDCE, then the new team member must get those 15 hours within 4 months of starting. All right, so if they got hired in May, we would want them to have those 15 hours by September. All right, so 4 months later. So that is this portion of standard 3, what it details. So again, this is for the non-CDCES and non-BCADM professional team members that you may have. If they don't have any recent hours, continuing education hours in diabetes education, they must obtain their first 15 hours within the first 4 months of joining the team if they are practicing as one of your professional team members in those disciplines. Right. The American Diabetes Association Education Recognition Program, or ERP team, they have made a very, very valuable quality coordinator guide, or QC guide, we call it. And it has a list, an example where you are welcome to track your staff members. You can just put it all basically on one page. You list the staff member when they got hired. You list how many continuing education credit hours you have. It also makes it kind of a one-stop shop. This example I'm showing as far as the chart, this is just a list from CBDCE of keeping track of diabetes education, care and education specialist hours. So this could be printed out for each of your team members that has all the dates and the provider. But definitely use the quality coordinator guide provided by ADA because it is a very easy way to track all of your team members in one place. It also keeps it very organized. So the quality coordinator should be definitely keeping this organized and up to date all the time. So start getting your professional team members or any of your team members at your service to get in the habit of saving all their CE certificates to maybe a shared drive at work or SharePoint even. If they can upload it there, just keeping it all in one place will make everybody's life much, much easier, especially if you were to become audited. All right. And then this is just another nice shout out to the American Diabetes Association because they have so many free continuing education credits. Many times they have over 15 available for someone to obtain. So if you have someone newly hired, they need those 15 hours within the first 4 months. Please remember ADA has many that are free. And then there's very little cost on some other ones, but it's definitely worth your time to check it out. They update this all the time. So if you need some quick CEs that are free or very low cost, then check out ADA, especially if your team members are in a time crunch. This will be definitely very helpful for them. The next portion of Standard 3 is talking about diabetes community care coordinators. And if you remember the previous national standards, they were called paraprofessionals. But now we are going to call them, per the 2022 national standards, diabetes community care coordinators. All right, so the DCCC team members, all right, must be if they're going to be part of your team, they must have a background or previous experience or training in various diabetes-related topics or healthcare, health and wellness, any other type of chronic disease. Maybe you have, for instance, someone on your team who is a community health worker, and they've been, helping with a diabetes prevention program through the state health department and CDC. So they have some background knowledge and training in diabetes, especially diabetes prevention. That might be their background. And they would have to show proof of this by evidence of either a resume or a certificate. So if they have a resume that says that they've been a community health worker for, the last 5 years working at the state of Florida Health Department Diabetes Prevention Program, that would be showing evidence that that team member has experience training in that particular topic. So diabetes community care coordinators, we really want to expand our reach here because there are so many people with diabetes, and we might not be able to have a really large team for our DSMES service. So don't forget about these particular careers and backgrounds, and these workers who apply for your jobs. They may be a great asset to your team because they have different experience, and they kind of have different experience and more of what we may think about as a non-traditional diabetes route, but there's nothing wrong with that. They can still learn and grow and be well trained. Now, the DCC team members, they do have to have supervision by the professional DSMES team member. So that could be based on some sort of performance appraisal tool, and I have a few examples to show you. These team members, just like we were talking about the professional team members, they must also have 15 hours of training providing the DSMES services and annually based on the anniversary month. But they need to have all of this training prior, so that I underline that word. So they need to have all of that training documented, that they have all of that experience providing diabetes DSMES topics. They need to have that prior to joining and starting to teach or be part of your instructional team. So that could be seen as a documented in-service, medication or device training. There's lots of different ways to document their competency in various topics that they would then be responsible for, helping to instruct at your DSMES service. All right, so this example is more about showing you that, you can have various diabetes community care coordinators, and they do have to have some, supervision by one of the professional team members. So let's say this service is, they are ran by a registered dietitian who is also a BCADM, and then they have a social worker on their team and a psychologist. Those happen to also be diabetes care and education specialists. And they, underneath them, they have their respective, wellness. I have a certified wellness coach, community health workers. They need to just be supervised, and one of those professional team members needs to do the professional appraisal tools on these staff members and making sure that everybody is proficient and more than capable of teaching their particular section of your DSMES curriculum. Right, so this is just showing who is the supervisory member of that. So if you do have diabetes care at community, diabetes care community coordinators on your team, please have some sort of hierarchy like this to show which professional team member is supervising them. Right. This is an example that was given to us by Care Express Medical Diabetes Management Center. And in certain states, actually, community health workers or promotores, they are licensed. So this is, for example, in Texas, where they have their license type. So of course, you would want to keep this information also as part of your instructional team member list with a copy of their license if they are licensed in the state that requires community health workers to have. So that is kind of a unique setting, and that's in various states, not all states. But in the future, this may be changing. There might be more and more community health workers getting licensed, or different types of health educators or wellness coaches that might have to go down state licensing route. But as of now, there's only certain ones. But keep that information up to date on any of your diabetes community care coordinators in your binder. All right. And this is an example of more like a performance appraisal tool that I was talking about earlier. So if you are, the supervisor of the DCCC team member, they would be paying attention to make sure, and document observation that yes, this person has pathophysiology, they were able to identify the difference and teach about this. They know how to list the complications of diabetes, the signs, the symptoms of hypoglycemia. So this is on all the different topics that are within a DSMES service curriculum. And the professional team member that is supervising these DCCC members, they need to just document observation and, also rate, effectiveness as well, and if the competency is met. So this is another example as well from the same center at Texas A&M actually. And this is a list of the different trainings actually. So this is showing us that the diabetes community care coordinators received recent continuing education in different ways. And it talks about how much hours they learned, what is their competency level assessment. So this is just another way to keep track of it. All right, for your diabetes community care coordinators. All right, and so that's pretty much it for standard number 3. And I just wanted to do just a brief testing your knowledge question. And this is asking you, so a DSMES team is made up of an exercise physiologist who is also a CDCES, a certified health education specialist or CHES, and also CDCES, and one social worker. So is this team in compliance with standard number 3? All right, and I imagine you probably know the answer, but the answer is yes. It is definitely, because there are 2 CDCESs on the team, they meet the standard. So even though the social worker does not have the CDES credential, that's okay. But because the exercise physiologist and the CHES are both diabetes care and education specialists, then this team meets the standard. And this is kind of reflective of the program that I work at as well. So we do not have a registered nurse or a registered dietitian or a pharmacist on our team, though I would love to have them. But we do not have that on our team. So are we still in compliance? Well, yes, we are, because myself and my coworker, we are both certified diabetes care and education specialists. So the reason why I do like to spend a little bit of time on this testing your knowledge question is for this tip on the side is I have noticed I've been a diabetes educator for a while now, and it took me a long time before I was able to even sit for the diabetes care and education specialist exam. And I was not able to take the exam for quite some time because I did not fit into the box as far as the existing diabetes care and education specialist, more traditional path, if you would. So on the left of this slide, you're going to see these are kind of more the traditional pathways where we see most diabetes educators could have these credentials. Well, I happen to apply using the unique qualification pathway, which is over on the right. And this is, of course, by CBDCE, the Certification Board for Diabetes Care and Education Specialists. They are the ones who regulate the Certified Diabetes Care and Education Specialist requirements. And this is what they opened up. So there's different requirements for each of these, but mainly, like on the last slide for the tip, I just want to make sure that when you are posting a position for you to have another team member at your DSMES service, please consider posting it as Certified Diabetes Care and Education Specialist or Certified Diabetes Care and Education Specialist. You could meet the requirements for it. So they are eligible, right? So you could say, we need a CDCES position or a CDCES position that is eligible. So CDCES eligible. The reason why I like to mention this is that there are so many jobs, and even in my area, I did a recent job search of just to see how they were laid out, these jobs. And every one of them I picked at some major hospital systems and health systems here in Tampa and Florida. They all said diabetes care and education specialist, but then it said registered nurse, or it said CDCES registered dietitian. So what's happening is they are limiting their job pool significantly. So you're going to have a whole lot less applicants. But also, I think part of the problem we run into is there's a lot of these job descriptions that have not been updated. So we're kind of posting them back with how they used to be posted, which maybe when there was only a registered nurse and registered dietitian who were performing diabetes education, but that has changed drastically over the last 20 years. And the whole point is we need to help people with diabetes, and we need to get more diabetes educators. So whenever you choose to post your positions, I would encourage you to post it as diabetes education, care and education specialist or CDCES eligible. Just so you could open up your job pool, right? Get you a person who maybe is an exercise physiologist for 25 years, like my coworker. He couldn't apply for any of the positions I recently looked at in my local area. He's been an educator for 25 years and he can't apply for them because they all say RN or RD. And I think, again, this is based on job descriptions are very hard to change, especially in large health systems. I know I've went through this path and it's a pain in the neck, but we really got to update these job descriptions and post them so we open up the doors for more people who are well qualified to be, part of a DSMES team can actually apply for your position. So please give that some thought and keep spreading that if you can. And then as I conclude here for standard number 3, I'm going to pass it on to another quality coordinator who is also going to talk about how they run their particular program and how they use standard number 3.